Hey guys, this is a short presentation on how to screen for perinatal depression, a step-by-step guide. Perinatal anxiety and depression occurs within the first year postpartum. It affects 10 to 20% of mothers and only 50% seek help. There are two types, major and minor. Pregnancy is not a protective factor against the risk of an existing mood or psychotic disorder. It actually increases the risk of relapse during and after pregnancy because it is quite a stressful time for these ladies. Suicide and infanticide are increased. Attachment of baby and mother may be negatively altered with perinatal anxiety and depression. The difference between perinatal depression and postnatal blues is that blues are usually temporary and transient, minor depression which gradually improves. However, postnatal blues can progress to perinatal depression. There are a few screening tools for the early detection of perinatal depression, and I recommend all health physicians to look out for perinatal depression, especially within the first 12 months. Maternal and child health nurses routinely ask case-finding questions at 4-week key stages and during consultations. So these are something you can ask. During the past month, have you often been bothered feeling down, depressed, or hopeless? During the past month, have you often felt bothered by little interest or pleasure in doing things? If they say yes to any of this or you suspect the lady to have depression, you can do the Edinburgh Postnatal Depression Scale, which is really simple and it's only 10 questions. You print it off and you give it to her for her to fill out. It's not used to diagnose depression, it's just a rapid screening tool. So if they have high scores on this, you would consider them undergoing a full psychological examination. But remember, it must not replace your clinical judgment. So even if they have a normal scale, you must still think that if this patient is at risk of depression, to refer them on to psychiatry or psychologist. So this is a step-by-step guide with examples of how you can approach screening for perinatal depression and what you can say with the different types of results. So how to introduce screening and gaining consent. Your emotional health is as important to me as your physical health. Routine care here at hospital involves asking you some questions that would help me understand a bit more about you and your situation, and if necessary, assist me to help you and your baby. Or the following information we discussed today will remain confidential and you will not have to follow up anything you don't want to. Obtaining the consent to do the screening process. I would like to talk to you about any past or present issues you might have and to ask you a few questions about how you are feeling and fill out this short form, and then we can discuss it. Is that alright with you? If a woman does not consent to undertaking the assessment, it's prudent to ask why they've declined the consent. Perhaps it's just time, limitations. Document her non-consent and her reason why, and offer subsequent assessment in future consultations. For example, would you feel more comfortable filling this out privately, or perhaps next time we see each other? So the initial case finding questions, as I mentioned before, were the 2 depressive symptoms. You can also do a case finding question for anxiety by asking, do you sometimes worry so much that it affects your day-to-day life? If the woman answers yes to any of these questions, use the EPDS scale. Introducing the EPDS. I'm interested to know some more about how you have been feeling. I wonder if you would have a look at this screening tool and fill it out. It asks you how you've been feeling the last week. I would like to ask you some more questions about how you have been feeling. One way to do this is to use a screening questionnaire. Would you mind reading the instructions and filling it out? Then we can talk about it. I know English is not your first language. If you prefer, I can give you the EPDS in your own language and we can discuss it. And the EPDS comes in many languages, around 50, and some of them had been verified and others have been non-verified, but they've all been translated, and you can find these online. Instructions for the EPDS. We would like to know how you have been feeling in the past week. Please indicate which of the following comes closest to how you have felt in the past week, not just how you feel today. Please colour in one circle for each question, which is the closest how you felt in the last 7 days. And so this is what the postnatal depression scale looks like. There's only 10 questions and they're very simple, like I have been able to laugh and see the funny side of things. I have looked forward to it with enjoyment to things. I have blamed myself unnecessarily when things went wrong. I have been anxious or worried with no good reason. I have felt scared or panicky for no good reason. Things have been getting on top of me. I have been so unhappy that I've had difficulty sleeping. I felt sad or miserable. I have felt so unhappy that I have been crying. The thought of harming myself has occurred to me. And so I'm just going to put an emphasis on question 10. So this is a screening question for suicide. And later on we'll discuss what happens if they click any of these three. So if they click never, we don't really mention this again. But if they say hardly ever, sometimes, yes, quite often, you want to delve more into their risk of suicide. So how to calculate it? Each item is either scored 0 to 3 or 3 to 0. A scoring template is provided. So you simply just add up the scores with the highest being 30. If they have 13 or more, that's a positive screen indicating that they need follow-up because they are at risk of higher depression. Any scores of 10, 11, and 12, they need retesting in 2 to 4 weeks because they're at risk of being quite depressed. And item 10 is the one that I mentioned about indicates thoughts of self-harm. You also must remember that the EPDS is a screening tool, and sometimes you can have false positives whereby they're not depressed but they have a high number, and false negatives. So they're pretending that nothing is going on, and so although they seem to have a low EPDS score, they are actually quite depressed. So use your clinical judgment in deciding which patients should go on to have more formal psychological assessment and support. So if you think that she is not being honest with her EPDS, you can say something like, it looks like things are going well for you at the present. Remember, you can always come and talk to me or other health professional if you feel that you need to. Sometimes it is hard to admit, even to yourself, that things are not right for you. If they have a positive screening result, you can say something like, over half of the women I see who answer like you have found, after a more full assessment of their situation, that they do need professional help with depression. Would you like me to line up an assessment to discuss further your current situation and to see if any additional support might be needed? Or, this screening form isn't perfect and sometimes it gets it wrong. You might be just having a bad day, but from looking at your answers, I'd suggest that you have a further assessment to look at how you are feeling and to see if you have the symptoms of depression. We can line that up for you now and make sure you have all the help you need. If they have a negative screening result, you can say something like, from your answers, you seem to be doing quite well. Is that how you feel too? Remember that I am happy to put you in touch with any further support you think you might need at any stage. We can talk again at our next visit about how you are feeling. If more than 0 on item 10, this is the one question that asks, the thought of harming myself has occurred to me, it is very important that you mention this again. So you say something like, I notice you have marked that you have sometimes thought about harming yourself. Can you tell me a bit more about these feelings? Or alternatively, you can say, I see you have indicated on question 10 that you, can you tell me a bit more about what you mean? Have you had thoughts that life isn't worth living? Have you thought of harming yourself? Have you thought about suicide? And ask about the current thoughts and risk. So if they are having suicidal thoughts, ask them, what exactly have you been thinking and how often? How compelling or powerful are these thoughts? Is it worse than previously? What triggers these thoughts? Planning. What have you been thinking you might do? And you want to really clarify how they're planning to undergo suicide. For example, if they're planning to drive off a cliff in their car, you need to ask whether they have access to a car. And if they're at very high risk of being suicidal, perhaps ask them to come back within 24 hours for another appointment to discuss more about this. And you also want to assess how lethal their specific method is. Ask them about the means. Have you been thinking about how you might do it? Do you have the means to carry out your plan using this method? Their intention. How likely do you think that you are to follow through and act on your thoughts or plan? What stops you? Protective factors. What are the factors that prevent you from acting on these thoughts? For those who are high risk suicidal patients, you want to ask them, have you ever acted on similar thoughts? What did you hope would happen as a result of your attempt? Did they want to die or end their suffering? Do you still have access to the method used? Do you use alcohol or drugs before the attempt? What did you use? Do you have access to a weapon? Ask about thoughts of baby harm. Have you had thoughts about harming your baby? Have you felt irritated by your baby? Have you had significant regrets about having this baby? Does this baby feel like it's not yours at times? Have you wanted to shake or slap your baby? Have you ever harmed your baby? And at the end, it's important to thank the patient and explain the plan from here on. Thank you so much for being so honest today about your concerns and about your thoughts about hurting yourself and your baby. This will allow me to put you in touch with an agency that can support you to keep yourself and your body safe. For those who are low risk patients, this is the management plan that's advised. Develop a safety and management plan, including a GP and a partner, and provide numbers for Lifeline, Suicide Helpline, Maternal and Child Healthline, Parentline, and Panda, and let them know that these phones are free and they shouldn't worry about paying for it out of their own pocket or whether they won't pick up because these lines are usually open 24/7, except for Parentline, which is only open at certain times. If you think they're at medium risk, there's a few more steps you can do. You want to consult with a senior colleague if possible. If in doubt, telephone the crisis assessment and treatment team and discuss the client. Develop a safety contract and management plan, including a GP and a partner. Arrange for a support person to pick up the client from the appointment and discuss a safety plan with support person. If necessary, request permission to develop a safety plan with additional support people. And again, give them numbers such as the CAT number for Crisis Assessment and Treatment Team, Lifeline, Suicide Helpline, Suicide Callback, Mental Health Advice Line, Parent Line, Panda, and have asked for permission to contact other health professionals involved and do a regular risk assessment. For patients who are at very high risk, so they're really thinking about self-harm, consult with a senior colleague if possible, telephone the crisis assessment and treatment team, telephone the community mental health service, and if the CAT and CMHS are unable to attend, arrange to take the client to the emergency department. Telephone a significant other and ask them to attend the ED. Arrange, follow up, and request permission to inform their GP, psychiatrists, or other health professionals involved. If you are to continue seeing the client, develop a safety and management plan and request permission to discuss this with other health practitioners involved. And also always do a regular risk assessment.